we will get to what I think is the last part, so part 4 of the sound stimulus and the ear, as we continue talking about how we code, how the auditory system codes for pitch. I'm going to repeat this picture and this concept because we have these two theories really for how we code for pitch or frequency on the basilar membrane, right? So frequency being the physics, pitch being the perception. One is that we have place theory. We do have this tonotopic organization where we have this kind of traveling wave that depending on how that liquid is waving through that scala vestibuli, it's affecting the basilar membrane such that it's waving like a wave or a rope snapping, and we're going to have some place of maximal displacement, and that place of maximal displacement is going to tell me something about the pitch, with the lower pitches being up towards the apex and higher pitches having their maximal displacement down towards the base. The other theory for how we code for pitch is called temporal coding theory, or sometimes frequency coding, which is a little ambiguous. And I should be underlining phase locking, that basically what this is saying, temporal being time, it's coded in time, that the neurons and their pattern of firing is phase locked with the stimulus. So at each peak of condensation, we are having the neuron firing, and at each place of the most rarefaction, we have a definite hyperpolarization. And so condensation, fire, rarefaction, stop firing. Condensation, fire, rarefaction, stop firing. And so for 200 hertz or so, I might be one specific neuron firing and stopping firing about 200 times per second. But actually what they find is I'm not going to respond at every peak. We're going to have what's called the volley principle, that I'm going to work with a few of the neurons around me. We are going to be firing at the points of condensation, and we're all going to be hyperpolarizing or stop firing at that point at those points of rarefaction. And this can occur up to a frequency of about 4,000 hertz. So if you notice the 4,000 hertz, so if you're watching along in these videos, you might have noticed that, and I should have looked this up because I might be just 2 hertz off, but it's right around. That highest note on the piano is 5,186 hertz, or right around there. So notice we're right at 4,000 hertz. And some people put this frequency, this happening up to about 5,000 hertz. But you'll notice, so if you go and play the piano, this is what is musical. The 88 keys of the piano basically gives me my musical range. Down at 27.5 hertz is close to our 20 hertz where we stop hearing. Anything lower frequency than that, as we get up to about 4,000, 5,000 hertz, our temporal coding is no longer giving us information, and it doesn't sound musical anymore. So if you even go up to the top 2 notes on the piano and tinkle back and forth, you can tell they're changing, but telling the direction of the pitch change gets harder, and that becomes harder and harder as we move farther and farther away. So as we're stopping those frequencies are so much faster than what the neurons can do, and we can no longer keep up with this temporal coding. That's where we also lose that kind of musicality, or that we can tell the direction of the pitch change. Coming back to this idea of temporal coding or phase locking, and that we are phase locked with the sound stimulus, I just went and scanned these pictures in because I feel like talking without the pictures almost seems a little bit like gibberish. It's really hard to imagine what's happening, so I'm hoping this helps. So if we look at the sound stimulus at the bottom of figure 1119, where I'm having those peaks of condensation, remember that's when it's going up, and then I'm coming down into those peaks of where it's rarefaction, where the air particles are the most spread out, or we have the lowest air pressure. What we see with the tectorial membrane, right, as it's shearing back and forth across those inner hair cells, it's going to push them one way, at the peak of condensation, and it's going to fire. The hair cell is going to fire, and then the tectorial membrane is going to pull the other way. We're going to close these tip links. We're going to stop the calcium and potassium from getting in. I'm going to stop firing, and then we're going to push the other way, or the tectorial membrane pushes the other way at that next peak of condensation, and it fires. Rarefaction, I pull the other way, and it stops firing. So it's phase locked is what that means. That's what phase locking means. It's phase locked with the sound stimulus. And of course, as we're getting into those higher frequencies, we can't keep up. We're getting into 2,000, 3,000, 4,000 hertz. And so we're going to have to share that that phase locking with our neighboring neurons, with the neurons around us. And so the picture over on the farther right shows how one neuron might fire, so about every other time, to try to keep up with some of that condensation. All of the neurons are quiet during the areas of the most rarefaction, or the times of the most rarefaction. Some other neuron's going to come in, or other neurons are going to come in and fire at those other peaks of condensation so that we can keep up with some of those higher frequencies. And that's what's known as the volley principle, that I'm really volleying this firing at the peaks of condensation with my neighbors and with my friends. And again, the temporal coding, it's the coding through time, sometimes called frequency coding. As what I'm hoping is clear here is that both of these theories are correct. We actually had some arguments for quite a while. We're going to see a similar kind of thing in color vision, that the argument went on because we were finding evidence of both, and then eventually they said, hey, both of them are happening. So along the entire range of hearing, it looks like we have place theory, that we do have this maximal displacement someplace along the basilar membrane. We do have a tonotopic organization. Again, we saw evidence of that, but we also see that the timing of the nerve impulses of the neuron firing, or the neurons firing, that temporal coding also is occurring, and that's happening up to about 4,000 hertz. Really, I've noticed in more recent studies, or might even be in the book now, that they say 5,000 hertz. But if you do notice those top few notes on the piano, as we get to about 4,186 hertz, it's not sounding as musical and as pretty, and it's harder to tell which direction the pitch change is happening. We can just hear that it's changing. And all of this really originates in the inner hair cells and their corresponding auditory nerve fibers. I do have a couple of places where I had some questions, and I went and found some things, and one of them that I thought was particularly important, I don't think I got a question about this until years later, but one of the first times I taught this, I thought, how do we code for amplitude then? Because usually, if you remember, and I'm hoping that you do, although I will say I'm going to probably say it somewhere, because I saw that it was one of the most missed questions on the exam, and it's often very confusing for students, that the way a neuron codes for the strength of a stimulus is to fire, to vary its firing rate. So if I have a stronger stimulus, I'm going to fire faster. I'm going to go fire, 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 fire as quickly as I can to say this is a strong stimulus, because the amplitude and the velocity of the action potential is going to remain the same. But here we have something completely different, right? That what we're looking at is the timing or the firing rate of those inner hair cells. A lot of times our sensory neurons do just behave really differently, and that firing rate of the inner hair cells, which are going to communicate to the auditory nerve, and so the firing rates of those auditory nerve fibers, that is telling me something about pitch, right? That's coding for pitch. So how do we code for amplitude, or the strength of the stimulus in this case? If you look at the frequency of 500 hertz, so I actually stole this from another textbook, and I'm sorry I did not give them appropriate citation, and now I'm not sure where I found it. Yeah, that was wrong. But so if we look at the 500 frequency, 500 hertz frequency, that particular pitch, and we look at B, that particular neuron, it has this threshold of, at about 40 decibels, it's going to fire. Well, what happens when we get that particular frequency up to about 60 decibels? Well, now neurons A, B, and C are firing. And so now, and remember we have 3,500 of these per ear approximately, and so now it's going to be the number of neurons that are firing that is going to tell me something about amplitude at this level. I'm going to end here a little bit early as we're finishing up this chapter, and I'm going to really briefly discuss hearing loss. I didn't see it in any of the interests or hear about it in any of the interests, and so, but I will go through it since we're at the end of the chapter and I have a little bit of time. So conductive hearing loss is separated or distinguished from sensory neural hearing loss, where conductive hearing loss is when something is happening along the way to the inner ear. So usually it has to do something with those ossicles. It's something's going on with the ossicles, and so it's not being conducted. And oftentimes this is taken care of with a hearing aid, and it's just amplifying the sound like the ossicles would amplify the sound. Sensory neural hearing loss is very different. This is happening with the sensory receptors or somewhere in the neurons in the auditory nerve and the neural system. Usually it's something to do with the, so if we can use something like a cochlear implant, what that does is takes the sound, processes the sound, translates the sound, and then directly stimulates the auditory nerve. So if something's going on along the way, neurally, in the sensory neurons, a cochlear implant can be used. So I mentioned presbycusis before, that it's noise-induced hearing loss that we used to see a lot more that was work-related, but now we're seeing more and more leisure-related hearing loss. We see a lot more presbycusis in developed nations, or in developed nations than in developing nations. That we see it more in industrialized nations. And so one of the things they just suggest is to take breaks from overstimulation. And I did talk about that for a while on a previous slide, so I'll just kind of leave this as it is, as I feel like I've said what I kind of need to with hearing loss. And we are finishing up, I'm pretty sure, with this chapter, so that we'll talk about sound localization and the auditory scene on the next day, on Wednesday.